I'm Laura Pankowski and I'm going to do PPE. So before actually going to see my patient, I'm going to check the patient's charts and determine what kind of precautions need to be made before entering their room. The next thing I'm going to do is I'm going to make sure that all of my supplies are ready prior to going into their room. After that, if any kind of personnel or anybody that's going to come in contact with the patient, like visitors, I'm going to inform them about the precautions and then tell them about PPE as well. Then I'm going to perform hand hygiene. After I perform hand hygiene, which I have just done, I'm going to put on my PPE. So first, we're going to start with the gown. And the gown is going to go over my clothes. The gown is going to tie up. And then it's going to tie around my waist. The next thing I'm going to do is I'm going to put my mask on. My mask is going to go over the bridge of my nose. It's going to go above my ears and behind my ponytail. The next part is going to go under my chin and behind my neck. Next thing I'm going to do is I'm going to put on my goggles and then my gloves. I want the gloves to go over my actual gown. And now I'm ready to enter the patient's room. So after being with the patient, I'm going to remove my PPE. The first thing I'm going to do, since my gloves might be contaminated, I'm going to pull the string in front of my gown and I'm going to kind of shimmy that off. Then I'm going to remove my gloves. To not contaminate my clean hands, I'm going to pull them off like that, bundle them up in this hand, and do the same kind of process. And now I would actually be throwing these away if I wasn't using these for clinical practice. So I'm going to set them here for now. The next thing I'm removing is going to be my goggles. And then I'm going to remove my gown. I want to remove it from the inside out, but I'm not touching any kind of chemicals.
Perfect. Look at you, pro.
And then I want to make sure that I keep it turned into the inside, bundle it up from the inside out, and then again, I'm going to discard this. Same thing with my mask. I'll remove the mask last, and I will discard that in a trash as well. After that's done, I'm going to go perform hand hygiene again, and then I'm all done.